Let's talk about advocating for ourselves. What does that look like? In our culture, it can feel really intimidating to think about having to advocate for ourselves, especially with this idea of like, oh, listen to the doctor, or, like it's what our parents grew up with, it's what we've been told. We have to listen, we have to, like, they know better for our bodies than we know for our bodies. And I feel like that is really changing around. People are really asking for something else. And I think that that's the biggest work here, is for us to change that in our minds. And that's like really subtle changes. Basically, it comes down to, what is it that I have a preference for in labor? What is it that I really want? Coming back to that, and then knowing that you are worthy of going for that. So when we come from that place, it really comes from how we grew up. So if we grew up with parents that talked about their bodies in a way that they had control, there was ways of improving what they were doing to their health, it will be a lot easier for the child that grew up in that environment to advocate for themselves, compared to someone who's grew up more in a, you must listen to someone else knows better for you, and also lacking information of what is the fundamental of health, basically. I come from, like, what I am known for, and what I did a lot of was advocating for people and giving my colleagues, midwives, doctors, nurses, nurse managers, the entire hospital feedback. And honestly, when clients would give me feedback to provide feedback to my colleagues, things did change around. Sometimes it took months, sometimes it took one day, sometimes it takes a few years. And that's not in your control. But what's in your control is that there is forward movement, and whatever is important to you, you can speak that out loud. Um, so the four tenets that I want you to just kind of consider, for yourself, because when we look at research, the amount of people that would do something differently or not satisfied with their birth is quite high. It's 85%. And I want to bring that right down. And I hope that this course helps you in, like, thinking of, all the options and the ways to ask questions so that you can make the best decisions for yourself. So the first one is confidence. So what gives you confidence in making decisions about your body? So think about that. It would be information. It's knowing about my body, what's happening to my body, and what are the options based on what is happening. Number two is control. So that means that you are participating in your care. You are using your voice actively. Can you tell me more about that? I want to know more about, what are my risk factors? Like, how is that going to impact my care, rather than being told when you're term that there's a recommendation to be induced? You'd like to know that right now. The relationship with your team, your care team, is really important. So asking the questions like, you are supporting me in my decisions, but will your team members do that as well? Just so practicing, I would also say practicing advocating for yourself is going to make you feel more confident, or give you like red flags that maybe you need to work on with your team, and changing your team. For some people, it is changing their team. So the one way that you can practice this is, hey, this requisition, what is it for? Okay, so for this gestational diabetes thing, how's that going to impact my care if it comes back positive or negative? Just like starting right now, having these discussions. And if that's already hard for you, then when you go to the coffee shop, you can ask for what you truly desire, like starting there, or with your partner. What is it that you truly want? Can you have that discussion with your partner? What is it that I really want for my labor? What is it that I really want today from you? Those are all things, like the way that we advocate to your care provider is the same way that we advocate for ourselves in our daily life. And for some people, that's really hard everywhere in life. And for some people, it comes with ease. For the person that has a hard time advocating for herself in all aspects of life, go hang out with your friend that doesn't, and just see her, how she communicates with people, and get expanded by her, like, show yourself, yeah, like, it comes easy to her, like, I can do the same. I think that it's really important to go hang out with people who feel like they got good care, and that they were participants in their labor? What made them feel confident and satisfied about the outcomes of their birth? So, going to hang out with them is important for the subconscious to know that these things are possible. The fourth tenet to having like a good birth outcome is the need to stay active in labor. So asking questions to your care provider, can I deliver while I'm standing? Can I deliver off or on the bed? Does the bed allow me to change my position? Do you feel confident in delivering someone who is on her hands and knees or etc.? In the bathtub, like moving in labor really is the thing, and not just birth. Moving in labor gives us a lot more control, and it feels better to be like that. Often being upright and leaning forward. It's just what people that have the freedom of movement just kind of go towards. So now the thing that about like seeing your care provider on this like hierarchy thing, your care provider is not up here and is not down here. They're here. They are human, just like you. And we need to see them as educators. They are educators in what they know. And you are the one who is making decisions about your body. At the end of the day, the decisions that you make about your body, they're the ones that you're going to have to live with for the rest of your life. Your healthcare provider won't have to do that. And so, understanding what's happening in your pregnancy is going to help you make the best decisions for yourself. So let's say there was a risk factor that your healthcare provider said that you had. Maybe your age is advanced, is what the word is, or maybe your size is bigger. So how does that impact my care? Like, what does that make me more at risk for? And by how much? Those are things that will alleviate fear. It doesn't mean that you're high risk in everything. It means that you're high risk in some things. What are the things that we can do to reduce that? So there's this acronym that makes it easier for us to advocate for ourselves, and it's the acronym BRAIN. And so B and R start off like the same question: is what are the benefits for this? What are the risks for this? So what are the benefits and the risks? Oftentimes it's the partner that will start advocating, especially in labor. It's just harder for the person who's in labor, who has to stay in her body. And then the partner can be in his mind and ask the questions: what are the benefits and the risks of breaking the waters? Can you tell us more about that? Then the next thing after that is alternatives. So is there anything else we can do other than breaking the waters? If your heart isn't like, yeah, I really want to break my waters, then you can ask more questions. What is another thing that I can do? Maybe there isn't very much that we can do, but maybe there is. Maybe it's sitting on the birth stool and squatting for a whole hour and bringing that baby's head down. Those are questions that you can ask. So if you do make the decisions to break the water, let's say, you'll just feel more confident about it. Breaking the waters, I'm just using it as an example. It's something that's actually really commonly done. However, that doesn't mean that you don't have a say in this. It's happening to your body. It's different also for someone who is not in labor and getting their waters broken then, and someone who is in labor as well. So what does it mean if we need to break my waters? So the benefits of that would be that when the waters break, the more that comes out of the uterus, the pressure in the uterus changes, and then it can make you contract more efficiently so that your progress can increase. So that's the benefit. The risk isn't very much if your baby's head is really well applied. So your care provider can talk to you about if the head is like putting lots of pressure in your pelvis. And the alternatives, if we're sitting down on a birth stool, let's say for an hour, will my contractions really change in regularity? Will they come more frequently if I do that? Or will it help actually bring my baby's head down so that it's safer for the waters to be broken? The questions, right? Then I is intuition. I really think that we don't step into the world of intuition enough. Intuition leads us to the right places. Intuition is not, there's no urgency in intuition. Intuition is just like, I know that this is the right thing for me. It's not pressure, it's not urgency, there's no fear in intuition. It's just like, I just know that this is the right thing for me. And I don't know why. It's not up here, but I just know that this is. Um, and as we're stepping into motherhood, intuition becomes and has to become really deep. And so let yourself get there. You're pregnant now, step into it. Ask yourself, is there fear right now? Am I making a decision because of fear, because of what a story that someone has told me before? Am I getting information from people who have fear? This really does impact your intuition because stepping into intuition might make us do the opposite of what the fear and the mind have told us. I really believe in knowing, increasing our knowledge, and then aligning it with our heart. And then that will make us step into the best decisions for ourselves. Now, N is your no or your not yet. Or it can be, can I have 5 minutes? Can I have 5 minutes? I just want to like think about this. Or I want 5 minutes more to try to see if my body will push. Just 5 minutes. It could be also a whole hour. It could be half an hour. Or maybe you're like, Leanne, I've been in labor for this long. I really want progress. Like, I really want you to break my waters, Leanne. Like, I'm not happy that I'm only 7 centimeters still. And that's totally okay. And sometimes intervention is a really great thing, but knowing the information will make you know if it is a really good thing for you or not. The question that I love and the question that I wish more of my clients would have asked me was, what is the evidence for that? That really would have opened up, that would have given me permission to tell you there's no evidence for this, or the evidence is very small, or the evidence really is there. And then I could have gotten really nerdy with my client. When there is no evidence for this, for something, it means you just have more options. You'll have a deeper understanding of why or why not. And then you can start being like, well, if it's not evidence based, then what are my other options? That's asking for your alternative, the A in brain. And that will make you a lot more confident before you make that decision for yourself. So, what is important to you? Stick to that. One thing that I really like to tell people here in Ottawa, where I live, there are 4 hospitals. There's one hospital who does skin to skin in the OR. So, for every woman who has a C section, if her baby and her are doing well, which is the majority of mom and baby dyads, we put the baby skin to skin on her here. Then there's 2 other hospitals who you only get the skin to skin if you ask for it. And then there's another hospital who doesn't do it for anyone. And if there were 3 women who would advocate and they would say, I know that it is evidence-based that we do skin to skin in the OR. What is it that you offer here? And then they would say, well, I can go to another hospital and get that evidence-based care. That would flip around. That would get to the nurse manager, that would get to the head OB, that would get to the head midwife, and there would be movement. And in Ottawa, it would be a simple phone call. Hey, can you pass me your protocol, your policy? It would be really easy for them to change that around. So you don't need to get out of your way to advocate for the whole world, but just what's important to you. What is it that you want to know? How can you use your care provider as an educator?